Well, hello and welcome to the Hooked Up Health Podcast. I am your host, Dr. Sean Lordan, and today I've got Kate DiFiore with me,
Hello.
the owner of Aura Longevity and Wellness. Kate is a board-certified nurse practitioner dedicated to helping patients achieve optimal health through a hybrid approach to medicine, blending traditional healthcare with preventative and wellness-focused care. She earned her degree from the University of Massachusetts Graduate School of Nursing in 2017 and spent 6 years in urgent care, gaining extensive experience in managing a wide range of medical conditions. So that's my background on you, Kate, but feel free to tell the audience a little bit about yourself and your story.
Sure. Yeah. Well, thank you so much for having me. Very excited to be here. I actually did not originally start off in healthcare. I started off in education. So when I was in high school, I was very focused on being a teacher. So when I graduated, I went to teaching college out in Western New York, and I actually have my bachelor's in elementary education and special education. So I did that for a few years, and I don't know, I just have wanted more of a challenge. My mom got sick. She had cancer, and it was a very, very rare form of cancer. And she passed away 10 months after her diagnosis. So I spent time with her in hospitals, helping her, in her hospice bed. And it kind of shifted me into that healthcare realm. So that's why I originally switched. So I started off getting my just RN with an associate's degree. And then my first job was at Arrington Hospital on the med-surg floor as a nurse. So that was eye-opening. And I think about that a lot. And I have dreams about it because it ties it to what I do now. Just seeing people at their worst. People who have not taken care of themselves a lot of the time on a med-surg floor. And now they're dealing with those repercussions later in life. And it's really sad. So I did that, and then I switched into the emergency room. So now more acute issues, but still a lot of the same. People who haven't taken care of themselves are showing up because everything's hitting the fan, and they don't know what to do. So while I was in the ER at UMass, I got my NP, also from UMass. And when I graduated as a nurse practitioner, that's when I went into urgent care. And I started at Carewell Urgent Care, and I worked there for 7 years. And it was depressing. You are just, like I said, you're seeing the worst of the worst. So people who's just been actively avoiding primary care, and now they're showing up with chronic issues that are directly related to just years of poor lifestyle choices, and they're looking for an acute fix. And it was frustrating. You do get your normal, like, oh, I got a rash. Well, you're supposed to be here. But I would get people that I had to call an ambulance for because that's how bad they were at that point. So it became clear to me that it was a very reactive form of medicine. And I don't want to do it anymore. I think that the future of medicine is in data-driven prediction and prevention. So that's why I shifted my focus to that. And that's how I am where I am. So it's now building a foundation of health like before you crash. Because we want to maximize your quality of life, not just, avoid sickness. So
Yeah, I've had a similar experience, and my wife Brooke can attest. We both, when we graduated from Northeastern, we both worked in skilled nursing facilities.
Oh, wow. Okay.
And, even in rehab hospitals. And it's sort of the same. It's tough when you're in your 20s to kind of to understand, especially when you're new in the field. It's hard to say, oh, you see an 80-year-old with deteriorating health. It's like, oh, well, isn't that all 80-year-olds?
Right.
And then as you're in the field longer and longer, you realize that there are plenty of octogenarians with really great health, who are in great health and have, what we know predicts, quality of life in their life, which is, great relationships, a strong peer circle. And, when you look at the blue zones, like what are some of the most common, and I know that's sort of how you're kind of really where the niche is with auras. Like we're trying to prevent some of the things that we know cause bad outcomes in later in life, right? Like improper eating, proper lifestyle, poor lifestyle choices. So do you want to talk a little bit about what those lifestyle choices that you used to see in the urgent care are?
So I do want to go back to just one thing that you just said about, when you're 20, you just like can't really see the big picture. And I think that's really important because when you're 20 and you feel like a god, you don't see, the future of, eating healthy, your metabolism's great. You can build muscle really fast and, you see those gains very quickly. And so I think that in general, there needs to be a shift to, I know we talk about it with kids, obviously, but really just letting them know, like what you just said, you don't have to end up in a wheelchair when you're 70 years old and spend the rest of your life like that. There's 75-year-olds out there running marathons right now. And that should be what everybody's trying to get to, on marathons necessarily. But, that lifespan versus health span, which I don't know if you're familiar with Dr. P or Tia.
Yeah, so he just released a masterclass, actually. I love masterclasses.
He did? I didn't even know that.
Yeah, so it just came out, so I'm looking forward to that.
Okay, well, I'm going to have to sign up for that because I would say I read his book pretty early on. It was recommended to me by actually one of my clients now, and she's become a very good friend. And she's like, this book changed my life. And I was like, okay, I'll try it, And it changed my life. I loved just his position on almost everything. I loved his approach about, the health span versus the lifespan and the functional movement. For someone like me, who I kind of struggle with that, like physical part of it all, having something more realistic. So like think about it, do you want to be able to get out of a chair when you're 70 years old? These are the basic things you need to be doing. So I know it's a little bit simplistic in that sense, but his work has really guided my entire practice.
Yeah, and ours too. And I think, there's research that ties, quad strength, so leg strength, to mobility and to mortality, right? So the weaker your quads are, the weaker your grip strength are, the more likely you are to die later in life, because you don't, like, if you can't grip, you can't, push yourself up and out of a chair. If your quads aren't strong and your glutes aren't strong, you can't get up and out of a chair. And if you have a hip fracture, we talk a lot about baseline, right? Like improving your baseline strength so that when something does happen, which inevitably it does, you might have a fall, there might be an accident, you might get a serious illness, but it's so important that people create a healthy routine of working out, even if it's just 2 or 3 days a week, just to establish a good baseline. Because there is going to be an event in your life that's, unless you're truly blessed, and that's probably 1 in a million, right? But something will happen eventually where you get sick and, you'll lose muscle mass.
Right.
And that muscle mass is truly what keeps you, strong. And to me, it's one of the main factors of living a long, quality and healthy quality of life versus just living life.
Right. Exactly. I think the biggest thing you said, another thing that just guides my entire practice, is that idea of consistency. I don't work out every day. Don't tell me. But sometimes my life gets in the way. I've got 3 kids. I run a business. There's a million things going on at all times. So sometimes I don't get to get into the gym and lift to do weights. Maybe I just take a walk that day. I've set myself a goal of, at least 10,000 steps a day. I have Aura rate, I track all my data. I love data. But I really try to get 10,000 steps. And that might look like just a couple of 10-minute walks around my neighborhood just throughout the day. If I had a second, like, I'm going to just take a quick little walk and then I'm going to go do what I'm doing. And getting to the gym several times a week consistently. It might not be the same. I might go 2 days. You know what I mean? I do Pilates, try to do it consistently. Try to eat well consistently. Yes, sometimes I have pizza. I like a drink here and there, but consistently I'm trying to make good choices. And so that's something that I try to talk about with my clients when they start to feel kind of discouraged. And you don't have to be perfect. You just have to be consistent. So that's like a big thing that I like to tell people.
I had this client one time, and he was friends with Jerry Seinfeld. And so he met Jerry Seinfeld when he was younger, and kind of just like, he made it big by that point, but they were having a candid conversation of what made him successful. And this might be public information now, but Jerry said, I looked at things in 90-day intervals. What I would do is I'd take a 90-day calendar and I'd mark on the calendar with an X every day that I practiced, my stand-up routine. And he said, it's just really hard not to be good at something if you do it every day.
Exactly.
And so I took that because I think it's a really powerful thing when I bought a 90-day calendar, and I literally I track, I X off the days that I work out, and then I reflect on like the month at a time.
Yeah.
Because you're going to have off days. You're not going to feel great some days. You're going to be too busy. You're going to be traveling. You're going to have something for work. But it's hard not to be fit if you work out 20 to 25 days per month. So when you look back, you're like, wow, I stacked 75 days of working out at 95 or 93.
Right.
That's pretty good.
Yes, exactly.
So I think it's so easy for people to say, oh, I didn't work out last week. Like, this week is going to be tough too. Like, I'm just going to put it off. Versus looking at the wins from the past and saying, oh, well, I worked out 25 days in September, 21 in October. Let's see if I can get to 26 this month.
I actually want that 90-day calendar idea. I'm going to do that, I think.
Because it just gives you, you could see the stack of it. And like, it's so, you're not going to see results in a week. You may not even see results in 90 days. You're going to feel better. You might feel better, but the scale might not move. But that might just be because there might be a shift from, fat percentage to muscle mass.
There might be something going on metabolically. That's something that I would work with people on to figure out. Because when people don't see the progress that they're looking to see, there might be a reason why. And that's, kind of what I work with people on. I'm going to send them your way for all the physical stuff. I'm going to keep them for that.
And that's the other thing about PT too, is, my philosophy is probably a lot different than other PT clinics. Like, you come in and fix a shoulder or a knee, you come in for a body part. Like, when we look at people, all of our PTs think about the function piece too. Right. And function looks different for a 40-year-old than it does for a 70-year-old. It just does. I want to make sure that I'm healthy for my kids, and I want to see my kids grow up and live successful lives. That to me means got to keep my heart healthy. I got to stay strong, keep my muscle mass up, and, not let the weight go. But most people come in for PT, they want to get rid of the pain right away first, which is great. But then it's like usually something mechanically caused that pain from the get-go. And we're not tuned into our bodies because nobody gets massages because they cost, whatever they cost. And everybody looks at massage as a luxury.
It's absolutely not.
When it's not a luxury.
Not at all.
People need to get body work done, and if you've never had it done, you should really, and we do as PT. That's literally what we do as PTs is body work, like Graston tools, right? Needles, like we lengthen muscle tissue. That's where it needs to be. And then we strengthen it, right? But I think the plan of care, a lot of people think about a plan of care in PT ending when the pain stops, or even a couple weeks after to continue the strength, when in reality, it should be a relationship to make sure that your whole body is like the muscles are lengthened and then strong.
Right.
So it's a relationship to me. And the same thing with your business, right? When you think about looking at the hormones,
Just start saying, yeah.
if people are changing. So talk a little bit about, the person who's struggling. Maybe they worked out for the last 90 days, right? They worked out 75 of those 90 days, and they've got the fancy scale at home that says, well, the fat percentage isn't going down. The muscle mass is only slightly up. What's wrong? What do you do with that person?
So, I kind of bring everybody in the same way. And that's a comprehensive wellness assessment. That's how I begin the process. They come in and I do an advanced splat panel on them. And it's very comprehensive. It involves hormone health, metabolic function, inflammatory markers, nutrient deficiencies. And we take that with the person's medical history. And from there, funny enough, I make them a 90-day plan, because you do need about 3 months of consistent effort to see these changes. So my claims, 90 days. And for every person, it is completely different. So someone might need hormone replacement, and that might be enough to get them where I need to be. Someone may be low in vitamin D and B12, and that's what's holding them back. So we work on replenishing those levels. Sometimes for people, there is the weight loss issue. I would say that's a huge piece for a lot of people. And so I do work with people with GLP-1s. My approach with that is very different than I think a lot of practitioners. I'm going to have you do the comprehensive wellness assessment first, even if you're dead set that that's what you want a GLP-1. And if there's not, if we can find another reason why you might be having these symptoms, we're not doing the GLP-1 yet. It's not something I'm going to throw people on right away. I think it's a great tool, and I think some people do really need it. But for example, I had a client who her last came back and she was deficient in a few areas. And, I was like, well, we need to bring you up because these affect everything in your body, your sleep and your mood and your mental clarity. And I feel like I talked to her for like several minutes, and then her response was, okay, so you're not going to put me on the GLP-1?
Yeah.
And I was like, I'm not saying I'm never going to put you on the GLP-1, but what I'm saying is, let's fix this other stuff first naturally and see what happens. You might not need it anymore. You may still eat it. You may still feel like, oh, I have this food noise, which I think GLP-1s are great for. But it's a little frustrating sometimes. But
but it speaks to our society and our expectations as a society. Like, there's a pill now that I can take to
fix, like you were saying,
skinny.
Yeah. Don't want to be in pain anymore. I don't want to be overweight anymore.
It's just a scare. Nobody, and I should say nobody wants to put in the work, because that's not a true statement. I feel like, and I had Dr. Irwan on here, who was an obesity medicine specialist.
Oh, wow.
He gave a nice analogy of, and I'll probably misstate this analogy, but he used pneumonia. You're not going to treat acute pneumonia with a vaccine, right? You're going to treat it with an antibiotic. And so that kind of stuck with me. Like, if you're really obese and you have comorbidities, your PCP should be putting you on a GLP-1, right? But if you're borderline and there's something you can do, and you run a hormone panel, or you run a comprehensive metabolic and comprehensive health panel, for me, I'm nervous. I would be nervous to go on a GLP-1.
Really?
Personally, because I don't know if I'd use the word skeptical, but they're a relatively new drug, in my opinion, for what's kind of been on the market. And their stats have been out for probably 50 years.
Well, they've been on the market they've been out for 20 years or something. They've been out a lot.
And what do you think is the biggest shift I feel like it's the last 2 years where it's been?
I think people recognize that it was having positive benefits for the patients it was originally intended for. And so naturally you're going to say, okay, well, if this side effect of this medication, which ended up being benefit, the weight loss, that could be beneficial to people who don't have diabetes yet. So, I mean, full disclosure, I will say I went on one.
Yeah.
I did. I was unhealthy after my third son. I was very overweight and I was very unhappy. I couldn't do anything. Like, I was uncomfortable. Like, I didn't want to work out because I was overweight, and your body's so heavy and you just feel awful and tired all the time. And I did the basic labs at this was several years ago. So but there was nothing jumping out at me as being the reason. So I had a friend who had been using them, and she's like, you should give it a try. And I had a substantial amount of weight disorders, I wasn't like, oh, I want to lose 15 pounds, because I do have people that come to me and say that.
Yeah.
This is not who I'm talking about. You know, I was like 260 pounds and it was way too much for my body. So I started it and I didn't lose weight very quickly, which I think is another one of the issues that people run into is just dropping this weight because they're starving themselves and, you know, they're essentially anorexic while they just, you know, lose weight and lose muscle. But I kept myself kind of on a low dose and I lost the weight pretty slowly. But as it started to come off, I felt more comfortable exercising and like moving my body. I started playing golf, which was something I always kind of wanted to play, but you know, was awkward. And like, I ended up getting like a breast reduction. Like, so I did things, you know, that were a little bit outside the box, but, that weight coming off in all those areas is what allowed me to then go and create those habits in the gym or on the golf course. And those are things that I maintain consistently now. And so I'm not on it anymore. You know, I came off of it and, you know, there's obviously weight fluctuations that happen. And, but I think if you're using them right and you're using them to develop the habits that you can, you know, continue after, then I think they're great. But I do think they're abused for sure. And I'm very cautious now who I put on that. But you're never going to catch me saying that I'm not here for them because I do think they're a great tool.
Yeah. And I want to get back to your personal journey because I think that really affects your practice and how you train with your patients.
For sure. Because I can sit there and relate to that too. I'm like, listen, I get it. You know, I was there. I'll show you pictures. They're not good. You know?
Yeah. And I think that's, you know, and I think people feel more comfortable too when their provider has used them.
Well, you'd be like, hey, I was not that path. If I hadn't made this change, I don't know where I would be. You know, I wouldn't be great because I was very unhealthy.
Yeah.
My cholesterol was just off the charts. My A1C was never elevated, but I was like 2 months away from something like that. After I lost some weight and, you know, I'd been kind of exercising regularly, I redid my labs, obviously. And the way my cholesterol dropped was like nothing I've ever seen. It's truly unbelievable. And, you know, it's one of those things because it's like, yeah, I know you need to lose weight. And it's like, no, you need to lose weight because the rest of your entire like general health is going to be just immediately better. It's pretty cool, actually, obviously. But I forgot the question.
What were the GLP-1s originally invented to fix?
Type 2 diabetes. So they were a treatment for type 2 diabetes. But then obviously, you know, these people lost so much weight on them. And so that's kind of how they went into.
And so that's the shift of the last couple of years.
Yes. Oh, I think the shift was just recognizing, okay, we've had a lot of success in our diabetic patients. And, you know, it's like any other medication. A lot of them have multiple uses. And they said, let's try this as, you know, like an anti-obesity medication. I mean, brilliant business model. If you look at the United States right now, and that's, you know, half the problem with these companies like Eli Lilly.
The insurance companies aren't super thrilled with it.
No. I mean, so yeah, that's a really big thing actually for a lot of my patients because they're pulling coverage as of like January for almost all insurance.
Well, they're going bankrupt.
It's so bad and everyone's panicking. And I also, you know, prescribe compounded versions of these medications. So I can always get them, but they're much more expensive. Now you're paying out of pocket. And right now they're paying $35 pull pays. And it's sad. And I've seen such a difference in so many people's lives for all these medications that when they're used right, I fully support them. And so I am worried for a lot of my clients come January because they make huge gains in their health. And I don't know. We'll see. I mean, they're going to have to either go with the compounding or hopefully the habits that they've been working on and developing, you know, keep them where they are or keep them on their paths. But It's tough.
Now, walk me through, Kate, like your perfect patient. Like, who is that person? What do they look like? What is their past medical history? What does their life look like? Who can you help? Who is like the perfect person for you to be able to help?
So I would say that my my colleagues, my friends are my actual demographic right now. So I'm almost 40, and a lot of the people that I talk with on a daily basis are in that same age demographic where I go to Pilates, and I think the biggest thing people say to me is, I just don't feel like myself anymore. And they can't really put their finger on it. They're not really exactly sure what's wrong, but they just know, like, I feel different than I felt even 3 years ago. So, like, what is it? What's going on? And then they come to me with this question. And then, like I told you, I always, do the comprehensive wellness assessment and be looked at labs. And for every single person, if it could be completely different. But for a lot of these women, it's hormones. Their hormones need to be replaced. And I don't know if you just saw, but there was a huge move right now for this. They took the black box warning off of hormone replacement therapy that they put there, I think it's like back in 1999 or something like that. Because there was this study, it's been mostly disproven, was not, it was determined that the study just was not accurate. But what it did was it put a black box warning on these meds and scared an entire generation of women away from doing hormone replacement therapy. And so, I mean, it wasn't even an option because they had said that there was links to breast cancer. And so you have, I think like you and I, if we think about like the women in our lives that were older growing up, this was not something they did. This is what we were talking about with what you're expecting when you age, like what you're thinking is supposed to happen. Because for so long, doctors were telling women, this is normal. This is what you're supposed to go through. And, you just gotta suck it up and you deal with it. But that's absolutely not the case.
Talk to me about the hormones. Like, what will you find typically on a panel for like an average 4-year-old female?
So it really depends. So I mean, at that age, you could be just kind of entering perimenopause. You might already be in it. It's really different for every woman. But when I do your labs and I see, your estrogen's low, your testosterone's low, your progesterone's low, that's the first thing that I say. We need to replace your hormones. And that looks usually like creams. Some women do like to do like a testosterone injection. It's very small needle, like an insulin syringe, and it's a very low dose. We're not giving women 100 milligrams of testosterone like we are men. We're giving them only 5 milligrams, and that's all they need. And that, maybe we're doing like an estrogen cream, and maybe we're doing progesterone, and we're doing estrogen, we're doing progesterone at night as well. So immediately you're going to see improvements in sleep. You're going to see improvements in mood, mental clarity, your libido, which a lot of women is the problem for them as they, push out to those ages. That comes back. It's really cool. And it's so rewarding because I've got so many women who I've worked with who went to their doctor and their doctor said, this is it. This is what you got to deal with. And they don't want to live like that, And so when we work together and we put them on their, HRT, or a lot of times too, it's supplementations, even targeted like IV infusions and vitamin injections, and to talk to them, 6 months later and be like, okay, well, let's, how you doing? How you feeling? Like, they're like, I feel amazing. I feel so much better. And it's very rewarding. Same with men. I also have men that it's the same situation. Their testosterone's 200. They're in the gym. They're trying to work out. They're feeling so tired. They don't understand why they're not feeling as strong as they used to. It's because your testosterone is 200. So we put them on that, and again, see sort of protocols, IV infusions. I've really pushed into the more longevity kinds of treatments now. I do like the NAD plus and those kinds of things, and to watch them come back and be like, I've had guys say like you changed my life, and that is like to me the biggest just reward as a professional to have someone say like I couldn't hike, or my knee hurt so bad, and I do peptides as well, so like BPC 157 and TB 500 and all these different like tissue repair things like that. Because again, just like you, I'm always looking holistically. Okay, you can't work out because your knee, but you've gone to physical therapy and you've been doing that and it's not helping. Like, let's try this, because I will say those, I don't know what your feelings are on peptides. I love to know, but they're magical the way they work and the way that people just regain function. And so a guy that came in and was just knee problems, can't work out, isn't feeling strong, was so tired. And I put him on testosterone, and I've been working with him on different things. For him to be like, you changed my life, that's why I have
it's really special. And I think it's especially, and I think about, because we're like basically the same age, like I think about our demographic, and we were talking about this before we got on the podcast, but it's like that general feeling, just like, ugh. Like you wake up and it's just like, ugh.
Yeah.
When you go to your doctor and everything, all the panels are normal, or, maybe you have one thing a little bit high or whatever, and they give you a cholesterol net or something.
Yes.
It's like, all right, see in a year.
Exactly.
Right? But like, what about quarterly? Like, how are you not? So my cholesterol, let's say my cholesterol is elevated, whatever, 20%, 25%, you start a stat. And you're going to follow up in a year? Like, what is that? And you wonder why we're always behind in treating disease, because a year goes by. Who's checking in on me to see if I'm working out? What's the wellness plan for eating? There's no diet plan or meal plan. Half the time we live in an area where there's, good access to healthy food. But even I feel like when I go to Whole Foods nowadays, I've had this conversation in this podcast before. Like, you don't even know, like even when you shop around the store in Whole Foods, half the time you don't know what you're getting, or if there's refined sugar or any of the stuff added to your food. It's so frustrating. Even knowing what to eat, it's hard to eat well. Then you go out to eat, and then it's like, all right, well then you're screwed, because it's like, who knows what they're cooking it with and all that other stuff. And if you want to live a normal, balanced life, you're going to go out to eat every once in a while. So how do you navigate that without just eating a grilled chicken salad every time? Because that stinks. At least for me, that's not.
I don't have the answer to that, because I myself struggle. I love to go out to eat. But I do, it goes back to that like kind of consistency thing. I used to go out to eat and I would get whatever I wanted, and it could be a pile of gnocchi with chicken parm,
Let's go.
It could be 2 p.m. Now I'm like, okay, I will get a salad. Okay, I'll get a salad with chicken. I'm very focused on protein. Like, protein is this just holy grail nowadays. And I miss the times when I didn't think about protein as much as I do now. But I am, you make better choices when you go out. You maybe you don't have 3 drinks, you have 1 drink, and you just realize you can't do that every time. I wanted to go back to something you said, though, because you were talking about being in the doctor's office and then putting you on the cholesterol meds and checking you in gear. And I wanted to say that the other situation that happens too is you have your labs drawing your cholesterol's off the charts, whatever it is, and they don't even call you and tell you about it.
Yeah.
And I had that be told to me so many times where they're like, can you help me with my labs? Like, can you read my labs? And I'm like, well, who ordered them? And they're like, oh, my PCP. They're my annual labs. And I'm like, okay, well, they should be like calling you and going over this with you and talking about why your labs are so high and what you can do, and not just throw you a pill, but what is your exercise?
No, they send you a message in my chart.
Oh yeah.
And then a prescription. There's no call. Are you kidding me?
Nope. And it's such poor practice. And so I have a small practice. I know every single one of my patients very well. I know what their lifestyle is. There's not a single conversation that I have with one of my clients that doesn't involve their exercise routine, their functional movement goals. Even though that's not my area of expertise, I'm looking at their whole picture, because if I'm looking at your labs, if we're trying to understand, what's going on, I need to know about you. I need to know what you're doing. And then my job is to give you feedback and tell you, what you're doing is great, or here's what we could change, or here's what we could add. And I myself have PCP that I have to go to, every year. Because obviously, I want certain things covered by insurance. And I swear to God, I'm in there less than 10 minutes. It's like, hey, how you doing? Here's a quick physical exam. Oh yeah, your iron's, low. So make sure you're taking your iron supplements and we'll see you here. And that's it.
And it's the model of healthcare, Kate.
Yeah.
And I think that's where it's not my PCP's or your PCP's fault per se,
It's not.
because they're just trying to do the best that they can do in the system that we have.
We're probably seeing 20 patients a day.
Which is just, and again, it's an unsustainable model. And when we look at medicine as a whole, it's becoming less economically viable to go to medical school for 4 years, go to a residency, then go to a fellowship. Now you're 12 years into an education. And then you have $500,000 in student loans. You're going to come out getting a probably a nice salary, but you'll have worked for pennies for 10 to 12 years. And it's just, I'm not sure that the economics even make sense anymore. And then you have to see the volume of patients that you have to see because of the insurance contracts. It's just really difficult to keep up with. And it causes burnout and alcoholism and all these other things that we're seeing.
Right. So then you have a practitioner who doesn't even take care of themselves giving you advice. And that's the other thing I hear from people. Like, why should I be listening to this person who clearly doesn't take care of your own body or exercise or eat healthy? And they're sitting here telling me diet and exercise is to fix these problems. And it's very frustrating, And then even like we'll see you in a year. It's like, no, I see my patients every 3 months at a minimum. They have my number. They text me. I check in. Like, how are you doing? Is there anything I can help you with? I just think you're right. Sorry. You're right in the sense that these people are putting so much money, and trust me, I've got debt. I put a lot of money into my education as well. I have 3 degrees.
Yeah.
But it's just, you're right. It's the model, but I totally lost my train of thought. But it's also, I lost my train of thought.
That's all good. Somebody comes in this week and they're struggling with, just feeling like malaise or just like that, the blah, right? This week, somebody comes in to see you. What do you feel like? You're going to run their labs. They're going to come back. What is one thing that person can do this week after they see you to feel better?
So for people I think that are like struggling, maybe they're peeing, maybe they just don't even know what to do for exercise, things like that. I think the single most important thing people can do is go outside and get some sunshine. I found that when I lost weight and I started playing golf and I was outside in the sun, I felt like a totally different human. And I think that we don't realize how important it is. Within the first 15 minutes of within the first hour of waking up, go outside for 10, 15 minutes. And just be out there, and it just kind of it resets your circadian rhythm. And it really just, vitamin D is so important for people, and they come in and they're deficient in it, and they're like, oh yeah, well, everybody in New England is deficient in vitamin D. And it's like, yes, but we need to supplement that because you have to have optimal levels of vitamin D for good sleep and things like that. So I always tell people to go outside, take a walk, and that's what I'd say.
Yeah, and it's tough and obviously in New England, and especially in the winter, and the clocks get turned back, and 4:30 or 5 o'clock, it seems like it's pitch black outside.
It's pitch black. It's completely inappropriate. I was driving it straight. It was 5:30, and I'm like, what is this?
Yeah, and it seems like it's a surprise every year.
I know. What are you doing? Why are we still doing daylight savings time? It's so ridiculous.
But that's really good advice, and I think you think about nature bathing and grounding and those sort of things. Obviously, you're not golfing barefoot.
True.
But there is something to be said about, just being out in nature and what that does for you.
I feel so happy when I'm outside on the golf course. Just so happy. It's like I feel the serotonin entering my body. And I think golf is kind of what saved me because I got into that. So that naturally encouraged me to want to be good because I'm very competitive. And so then I was like, okay, well, you can't be good being overweight. You need to work on this. And like you were saying, anytime you put some effort into something consistently, you're going to see the change. I wanted to be good at golf. And so, I put in the time to do that. And now it's a huge part of my life. I just threw a charity golf tournament. My mom, she did have.
Yeah, I saw that. It's online. That's incredible.
Well, it got raked out, so it was very, very sad.
Oh,
But it was called the TF for Wellness, and I basically had this whole vision of like this wellness village that I kind of wanted like on the golf course, but then decided to put it like more inside after people played, just so that people could really give more attention. And actually, you guys donated to it. You donated to my golf tournament. But we had all these wellness vendors, so all these kinds of practitioners like massage therapists, PT, people that did like salt therapy, sound therapy, just all kinds of really cool wellness things that I don't know that everybody knows about. I didn't know about some of this stuff. And kind of put it as this like wellness village after people were golfing. So they could kind of walk around and talk to practitioners that were local and find out like what's available. Because everything that I do, it's a holistic experience. I'm not an expert in everything. And so I love to refer out to people. So I work really hard to build relationships with other professionals in the wellness arena in this area, because I can't do it all. And so the point at Turn was to bring all these different kinds of people together and kind of show the community like what's out there. And then on top of that, we donated to 2 really cool charities. So we donated to Abby's House, which works with women who are victims of domestic violence. And then we donated to Positively for Pink, and they work with low-income women who have breast cancer. And we raised $10,000. We didn't even golf that day. So I was very proud of that event, and ties back to, doing things that you love and incorporating it kind of all together, and what makes me sort of passionate about like what I do particularly.
I love the community piece of that, 'cause it's so important. Longevity medicine, Kate, in 10 years. What do you see different in 10 years than today? Where do you think the field is going?
Oh, this is really hard question, Sean. Especially with like the state of healthcare right now and the insurance companies and everything that they're doing to just make it absolutely possible to be your best self, because personally I think it might keep you sick. I could tell you what I hope.
Tell me what you hope.
What I hope would be that people are able to affordably work with practitioners who genuinely care about their health, who have the time to put in to teach them what they need to know, to not just throw them on a quick medication, and to really work with them about like getting down to like the root causes of their problems, which is what I do with people. But I don't take insurance. My practice is not affordable for everyone. It's just not, and that's an unfortunate reality. But I hope that in the future we're able to set up some sort of model where everyone can receive that kind of healthcare. Yeah, I was saying my patients test me. It's maybe the boundary line's a little bit blurred sometimes, but I'm happy to be there for that. And so I just feel like we were talking about, it's just that's not the case right now, and it really should be.
Yeah, well, that's a whole soapbox thing with insurance companies, and I hope that over the next decade or so, insurance companies will shift from reactive to proactive, and quite frankly, look at their reimbursement structures and really focus on, paying providers, what they need to be paid to be able to deliver a level of care that actually fixes problems, right, instead of it's just a Band-Aid, right? And I feel like that's where we're at right now. And our business, we take 90% of insurances, but there are still payers that are below the bar that we try to have, that are literally reimbursing us less than it costs for us to provide an appointment. And it's a struggle being a practice owner, knowing that insurance companies are really kind of getting away with, paying us for care that's less than it actually costs to provide the care. And to me, that's not okay.
No, it's criminal.
There are several payers we haven't gotten a raise across the state of Massachusetts since 2009 for
that's
workers' comp. Yeah, it's unbelievable. So, and this is like a period of like 35 to 40% inflation since 2021, right? So it's tough, and it's always that balance of trying to be a community partner, right, and accepting as many health insurance payers as you possibly can, right? We want to be a community partner. I want to be able to treat everybody, no matter their socioeconomic level, because everybody deserves to get at a human level, deserves to get quality care, great access to care.
Yeah, and I agree. The thing with stuff that I do is they're not going to cover it. So taking insurance really just isn't even an option. They don't cover these things. They're not going to cover an NAD plus infusion. So I struggle with it, and it makes me really sad when people come to me and they want to work with me, but they can't pay out of pocket. I will say the greatest thing I think that's ever been invented in healthcare is the HSA card.
Yeah.
And I recommend everybody have one of those, because even if you don't, see somebody like me who you have to kind of use your, health money for, you can use it for so many things. You can go on Amazon and buy your healthcare products. You could use it for glasses. You could use it for co-pays. So that is one way that I kind of help people use their insurance without using their insurance, is by saying, use your HSA, is at least in your state of the taxes and everything on it. So
Yeah, so Kate's talking about healthcare savings account, which is tax advantage savings. So you can use that for healthcare. So it's a smart way to do it.
Yep. And some people will ask me for something called a super bill, which is sort of like an explanation of benefits, or not benefits, of services. And they submit that to their insurance company. If they ever have questions like, oh, well, what did you use this for? What was this purchase? So that's something that I do sometimes too. So it's not you can't use your insurance at all, but it's not, like the bottle you use, or like a PCP where you go in there and you think you're going to get your laughs for free. It's like,
yeah, it's a little different.
Yeah.
All right. I usually end this with a little rapid fire.
Oh gosh.
So personal question.
I'm so nervous.
Favorite book?
Outlet by Pierre Tia. Truly. That's my favorite book.
I love that.
I almost brought you a copy, and then I was like, there's no way he hasn't read it. And then,
No,
and then you're talking he's a master class. I'm like, I gotta take the master class.
So there's a master class on it, so I'm looking forward to watching that whenever I get 90 minutes of downtime to that. But
so you have to sign up for it?
It's like a membership master class. So it's like
okay.
$100 a year or something. You get all these cool. It's like they cover everything from politics to cooking to
Oh, yes. I know what you're talking about.
It's really kind of neat. They have experts.
You have to have a membership, but actually, Pierre Tia sent me books for my tournament.
Really?
I reached out to him and I was like, here's what I'm doing. And he sent me signed copies of his books.
That's really cool.
So I have one that's to Kate and
I love
I was fanning about
cool. Favorite movie?
Oh my God, this is so hard. I love movies. What category movie?
It could be anything. It could be goofy. Mine would probably be.
Yeah, what's yours? See, it's hard.
Yeah, that's actually a big question.
Okay,
you go first.
No, see, you can't even answer the question because
I like stupid movies like The Hangover.
Wait, I was gonna say Bridesmaids, but I didn't want that to be what can I answer?
I just I like the funny ones.
I'm trying to think of my comfort movies that I watch over and over. What am I gonna put on and my husband's gonna walk by and be like, "Are you serious?" And I think Bridesmaids is definitely one of those movies.
Oh, it's funny.
Bridget Jones's Diary, maybe.
Never seen that one. I think comedy as a genre is just is great, and
I think it's always comedy I'm billing to when I'm just overstimulated and needing to just chill and rot on my couch. It's always going to be a comedy. It's never going to be something sad or dark. I'm going to laugh.
Yeah, I've been so serious around this all the time.
And Right Space to me is just such a fun movie.
Step Brothers.
Exactly. These kinds of movies. They're so funny.
Yeah, Honey Crash. Anything with Vince Vaughn, basically.
Vince Vaughn.
And then what's one mantra, Kate, that you live by, that you live to live by?
I think for me, something that's kind of guided me is it's never too late to work on yourself, to improve your health, your lifestyle. because I think we sort of talked about it in terms of like the working out when you don't, you don't go and you're like, well, I'm not going to go tomorrow. So I didn't go yesterday. And it's like, it's never too late. You can reverse so many things if you just kind of focus on what needs to be focused on. And I think people think they get to a certain point and maybe they're too far gone, or there's just no point because, it's not going to help. And it's never true. And so that's kind of what I always like think about when I'm thinking about my own self. Like, it's never too late, like, okay, you had a couple of bad days. We're going to jump right back in. We're going to start right back up. And that's just, it's something that I think about a lot. So
I love that. That's a great mantra. Awesome. Well, Kate, thanks so much for coming on today. Really appreciate your time. This was excellent. Thank you.